Hi, Dr. Meininger here from Meininger Family Chiropractic, and I'm here today with an amazing chiropractor, a good friend and a mentor, Dr. Curtis Martin. And Dr. Martin has been in practice in California for over 20 years, and he and his wife managed three successful clinics in the East Bay area. And really, the reason I'm talking with Dr. Martin today is because he's an expert with SoftWave technology. And so I am super excited to have him with us today. So I just want to welcome Dr. Martin.
Thank you, Dr. M, and I appreciate being on this morning. And I always enjoy talking about SoftWave because it certainly has changed my life personally, but also in the three offices, it has literally transformed so many patients that were scheduled for surgery or injections or even prescription medication, or just having to deal with things and experience pain every single day of their life. And when we found SoftWave, and now that you found it in your clinic, we've seen some incredible results. So I'm excited to share with you some of those results today.
Well, that's why I'm super excited about it as well. I know that you've had some amazing results. And so I would love if you would take a few minutes and just share some about the SoftWave technology.
Yeah.
More importantly, like what are you seeing with your improvements in your patients' lives?
Yeah. Well, it's absolutely amazing technology. And just so some of you that are unfamiliar with this type of SoftWave technology was actually developed in Germany over almost 30 years ago now. It's a long time. Yeah. And in Europe, they've been having so much success with it. It's finally come to the United States. Before this moment, before we got it in our clinics in the United States, that it was only really available to celebrities, athletes, people that could afford it. And now it's really here and available to everybody. So I'm super excited. But really, the technology, it works. It's more of a sound wave, which is really cool. It travels at 3,353 miles an hour, supersonic. So that sound wave goes into the tissue. And the cool thing is when it gets to a damaged cell, it does three amazing things. Number one, it's going to triple the amount of blood flow to that damaged cell, which that gives all the nourishment and oxygen. It helps recycle the bad cells, but also, which is a really cool thing, it stimulates your own stem cells that are circulating in your body to go there and start healing. So that way, no matter what you need in that shoulder and that knee, it can help form new bone cells, new muscle cells, new ligament cells, tendon cells, even nerve sheath cells. No matter what it needs, it can do that. And I think that's what makes it just so special. So just because that's the only technology that can do that. And I got to tell you, in 25 years of practice, actually it's a little bit more than that, but 25 years of practice, I've never seen something work so well. You got to experience it to really, truly believe it.
And I think that's the reason that I'm so intrigued with it. So just to let you know why I started looking into SoftWave is I actually had an elbow injury just about 4 months ago. And every time I adjusted it, it just flared it up more and more and more to the point where I literally stopped adjusting with my left arm for a while.
Wow.
And then I happened to visit a chiropractor in Boston, and he was telling me about SoftWave, and he actually had it done in one of the local big hospitals right in Boston for his shoulder. So I said, all right, I'm going to look into it. Of course, I didn't look into it right away. And then I had another chiropractor friend of mine tell me about his experience, and his was his elbow. And of course, I clicked, right? I have an elbow issue. So I went and I had 8 sessions of SoftWave, and it was a game changer. Now, here's what's really interesting. I got more. You can't cut me off yet, Doc.
Okay.
So I start telling a couple of my patients, and all of a sudden, one of my staff members says, my grandmother had that done on her knee a couple of years ago. Phenomenal results.
Yeah.
A patient, plantar fasciitis, not even 3 months ago, fabulous results. And so I love the fact that we're talking about a technology that can help the body heal itself, which I'm so in tune with. And yet it's just so powerful and gets such great results.
Yeah. And it's similar because once you start getting SoftWave stories, they keep coming. And one of my favorite, I have 2 elderly ladies that the same thing, Doc, is when you said 8 sessions they came in both with canes, with their knees that were arthritic, and they're like, oh, it hurts every single day. And they didn't want to do a knee replacement. They want to take medication. And we did the same thing. We did the 8 session of both their knees. And gosh, a year later, I remember them coming in, no canes. How you doing? Doing great. And it's always one of those things where it just changes people's lives. And that's what's so special about it. Like you said, it harnesses the body's ability to heal itself. And that's what really how we're designed to do. Like that's what the body's design is, to heal or adapt. So really, we're just harnessing the body's ability and really focusing that healing right in the spot that most people are suffering. So I've seen neck, middle back, lower back, shoulders, elbows, wrists, hips, knees, ankles. There's been so many body parts that it's been just super, super effective. And I can't say it any other way, but if you're suffering right now and you're listening to this and you're like, geez, I'd like to try it, you have to try it to believe it. And that's the great thing, is having the first mapping session, or we call it a mapping session, or discovery, to see if the technology will work on you. We'll usually see a very powerful response. And my response, first time I put this on my back, 50% reduction in pain, one session. So that's we got to try to believe it.
So that's awesome. And again, that's why we're here. So I also want to let everybody know that we are getting ready to have SoftWave in our office. It's going to be a couple of weeks from now, but we're going to have it in place pretty soon. And so we're going to start with just our patients. And so you're going to be having first access to this. We're not going to announce it to the public. We're going to let you have an opportunity to come in for what Dr. Martin called those mapping sessions, so that we can determine if SoftWave is going to help you and what would we need to do. And so just reach out to our office. Just let them know that you want to at least get on the list to give it a try, and we'll get you on our schedule and we'll get started from there.
Perfect. Perfect. I hope it changes every single person that tries it. I hope it changes your life. So good luck. And Dr. M, it's a pleasure to speak with you today. And yeah, I'm really excited to see how your patients do in your clinic. They're going to do, I know, super, super great.
I really appreciate it, Dr. Martin, and I thank you for being here.
Okay. We'll see you later. Bye for now.
Thanks. Bye-bye.